Back to the hospital.
Back to the studio.
Back to the future.
Yes. So at this point, they got me splinted up and they put me in ICU.
Do you remember any of this part?
No,
really?
not really. I just remember being in so much pain and being so like unable to think because I was in so much pain that all I could do was just look at a clock. I was just like staring at the ceiling the whole time, just like in zombie mode. Like I couldn't sit up, look left, look right. Like it hurt when people would talk to me. Like
the sound of their voice like fucking vibrated you.
Yeah, seriously, like their vibrations, like having to answer people back, just like the tone of even my own voice would put vibrations through my body. It would hurt. Like I didn't want to watch TV. I didn't want to do anything, and like the pain was so overwhelming. That's all I could focus on. Like it was impossible to even think about anything else because it was just so bad. Like I even remember thinking to myself, like, man, I could use this time to like think about stuff. But I'm like, dude,
you can't even think about
stuff. Like all I can do is just look at this clock. And I took a lot of my clock watching skills, if that's even the right word, that I learned when I was in drug rehab. Was like I just had to like count it out and be like, okay, if I can last 10 seconds, okay, made it. All right, let's do another 10 seconds. Okay, made it. And then be like, all right, how about 30 seconds? Made it. Okay, how about 60 seconds? Made it. And I just kind of like kept expanding it, to every like 10 minutes or every 20 minutes or 30 minutes or every hour. I was just counting down. And for the longest time, it was a countdown to my meds. I'm like, I just need meds. And what sucked is like they didn't understand that I could still feel pain even though I was a spinal cord injury. They thought I was like completely paralyzed and couldn't feel pain. So no one believed me when I was telling them that I was like in a lot of pain and I needed pain. They thought I was just like drug seeking. Like they were giving me like 5 milligrams every 6 hours. Like for those of you that know anything,
you're on more than that right now.
Yeah, when I left the hospital, I was on 10 every 4 hours, and that was like 7 days after the fact. Like, I was fighting tooth and nail to even get like basic pain management. I was like, for the love of God, like I was downstairs. They were giving me like injections of like fentanyl every 15 minutes, and then I come upstairs, and all of a sudden that pain isn't there anymore. Like, what are you talking about? Like, of course that pain's still there. Like, I was so like frustrated, and even more annoying is like they wouldn't give me my daily meds either. Like my therapeutic medication that I take every day, like my nerve pain medication and my antidepressants and my mood stabilizers, like they wouldn't give those to me because they're like, oh, like we can't give you anything else for pain. And I'm like, that's the wrong kind of pain.
It's nerve pain, you
I'm
dingus.
like, it's nerve pain. And
it was an opioid epidemic, honey. We can't
give you any more. And like I kept like having,
you heard of that?
And yeah, I know, right? And I was like, I literally at one point I go, yeah, I know about it. I'm a victim of it. I'm 5 years clean, but I need more. Like, and then
I am the opioid epidemic, motherfucker.
And then I started having these really bad leg spasms where like the only thing that would make my leg hurt is when I was having spasms, and then my legs would keep having spasms, and I was like, guys, I need something to make them stop spasming, and they're like, well, we just can't give you any more. And
because the spasms would be painful.
Yeah, and then like every time I got a new nurse, which was every 12 hours, I'd be like, I need my daily medication. I need to have this more than like every 6 hours. And I finally like begged for like 2 or 3 days to finally get them to do it every 4 hours. And then that still didn't help. And I was like, finally at one point I almost broke down crying. Like there was this one nurse. He was the only one that I feel like cared about me in even the slightest bit. And the reason I figured out later is he told me that he's got a 12-year-old nephew with spina bifida. So he got it. He gets it. He's like, yeah, I learned how to calf because, I learned how to calf on my nephew when he was an infant. And like, now that he's older, like that's his party trick. And I go, no way, I do that at parties too. I'm like, hey, you guys want to come see how I pee? But so there was just this like a little bit of compassion, and you could tell that he was also annoyed and frustrated because like the doctors weren't getting back to him. And I was like, dude, I'm tired. I was like, I'm sick and tired of begging. I'm sick and tired of having to fight and advocate for myself to get some basic pain relief. I was like, this is unnecessary. This is uncalled for. I know it's not your fault, but you're the only person that has access to that keyboard and that phone to send messages to the right people. I'm like, please, please, please just do anything and everything you can in your power. Like, please, I need your help. Like, I was like begging. And then finally he was able to get it like every 4 hours at like a 10 milligram, which is still pretty weak, but like it was enough to do the job.
It was double what they were giving you, right?
Yeah.
They were giving you 5.
Yeah. And then like,
And just for reference, like you said, they were giving you injections of fentanyl. What is that the equivalent of?
fentanyl is the equivalent, like 1 milligram of fentanyl is the equivalent of like 10 or 100 milligrams of morphine. And morphine and the pills that they were giving me is like about the same equivalent as morphine. So they were
It was like 100 times less.
yeah, like 100 times less. And they were
Jeez.
giving it to me like every 15 minutes. Like every time I was like, I hurt, they were like, zoop. They would, just like just shoot it into my IV.
Jeez.
Because they had to, like, for example, like when they were splinting me, like they had to keep me still and they had to keep me from screaming. So they would just give me stuff. Like, I always hate that. Like, whenever you're, like, in one area of the hospital and they move you to the next one, all of a sudden, like, all your history of everything you've ever done just, like, goes away. And then finally got to the point where it was, like, day 3. I still hadn't got, like, my antidepressants. I still hadn't gotten my nerve pain medication. We had asked every single doctor that, like, my sister pulled, like, the most gangster boss move ever and, like, went and talked to the charge nurse, like, the lead nurse ahead, and was like, hey, you need to give him his medicine. He has to have it now. And they're like, oh, no, sorry, we can't do that. We've already sent down a message. We've requested it. She's like, okay, no problem. That's all right with me. I'm just going to need you to have that in writing, and I'm going to need you to sign it that you are refusing to give him his medications. And then she said the look on her face was like terror. She's like, oh, my God. Because, like, whoever signs that piece of paper is like liable, and hospitals do not like being liable for anything. So that's a pro tip for you guys that are listening. If you're ever in a situation where people are refusing you any type of care, make them write it on paper and sign it, and that will send the fear of God through their souls. Because in 5 fucking minutes, I had all my meds. Like in 5 minutes, they literally like called downstairs and was like, they're gonna sue, they're collecting paperwork. Like that was not our intent. But like my sister basically was like, okay, cool, sure. Like she was really nice about it. She's like, okay, that's no problem.
We're just gonna fuck you up. You're just gonna ruin your life.
I understand that that's okay that you can't service him, but I just need it in writing and I need you to sign it for me.
I understand.
That says that you're refusing care. And they were like, skirt. And then literally even medicine that they said, oh, sorry, our pharmacy doesn't keep that in their formulary, magically they had within 5 minutes.
Oh, no way.
No way. I was like, how interesting is that?
Dude, they must have built a fucking formulary or something.
Liars. And dude, I'm telling you, like there was so much stuff. Like every time I got a new nurse, they were trying to like start a fight with me. Like every time they would be like, hey, I remember one lady, I literally like she came in and she didn't even ask me like how I was feeling or if it was okay to touch me. She just started like touching me all over. And I was like, hey, pardon me, excuse me, please don't touch me. I was like, thank you. I was like, I would really appreciate that if you would not touch me. Thank you very much. I'm in a lot of pain. If you want to ask me before it's okay to touch me. And she's like, you're a spinal cord injury. You can't feel this. And started like poking at my legs. And I was like, excuse me, don't touch me. She's like, you better lose that attitude with me or we're going to have a bad day. And I was like, I said, don't touch me. That hurts. She's like, we need to lose that attitude. And I go, I don't think I'm having an attitude right now. I said, please. And I said, thank you. I said, please do not thank you. She's like, well, you need to lose that tone with me. I go, forgive me for having a tone. I haven't slept in 2 days and I'm completely delirious and in a lot of pain. So forgive me for having a tone. Can you coach me? Can you teach me how to talk to you? Because I don't know how to talk to you. I said, please do not touch me. Thank you for not touching me. What else can I possibly do? And she was like, ugh, and just like walked out of the room. Like I literally had like this is some weird shit right here. And like, I'm not the type of person to like, it was like day 3, which means I had seen probably 4 or 5 nurses at that time. A lot of nurses will come back and see you again. Like, it's like you're on rotation. Like they'll come back into the room and you're like, oh, hey, it's that nurse I've had before. So every time a new nurse came into the room, granted, I'm like laid on my back, looking up at the ceiling. I'd be like, oh, hi, have I had you before? Like I'm just be like, hey, have I had you before? Because if they're like, yes, I'm like, okay, cool. I know how to talk to this person. I know how to communicate with this person. This person cares. This person doesn't care. They're friends with my family. They're friends with me. We don't know. Like, it was just like a whole thing. And I was like, hey, excuse me. Have I had you before? And she goes, oh, so we all just look alike, do we? And I'm like, wait a minute, does she think I'm racist? Like, I was so confused. I'm like, is she even black? I can't even tell. Like, I'm staring at the ceiling. Like, what is going on right now?
She was insinuating that you were saying all black people look the same.
She was just like insinuating that I was like some white dude with a beard and tattoos. So it was like, man, I don't want no racist.
Oh, have I had you before?
Like, I
can't fucking tell.
I can't tell. I don't want you doing my care, knowing people like you going to be touching people like me. Like, that is not what I was going for at all.
Looking at the ceiling.
I was looking at the ceiling. I was like dead to the world. I'd slept for like 2.5 hours, and the 72 hours I'd been there, I was delirious. I was just trying to figure out who was in my room. And like, this is what I mean by just like ego driven and like and just incompetent and just trying to start fights. And like, I had a doctor come in the room, and Jalila was here. He came to examine me, and the dude might as well have been punching me. Like, at one point, he like started grabbing my leg, and I was like, please don't touch it. He's like, oh, you can feel that? And I go, yes. He goes, how can you feel that? And I go, I'm a L2, spinal cord injury, incomplete. He goes, what does that mean? And I go, it means I can feel temperature some places. It means I can feel pressure and soft touch some places, and other places I can't. And I've got some function and I have some don't. He's like, oh, okay. And he was the head of neurology, like the head of like neuro people. And he was there to come examine my back. So he just like grabs me by my shoulder, my bad shoulder, like pulls me up and starts like a karate chop, like starts just whacking at my back. And I'm like, like I'm like losing breath, like choking. I'm like, I was like, stop. And I'm like, I'm like, why did you do that? I was like, could you please be more gentle? And he's like, oh, well, forgive me for just examining my patient. Here, take this pillow and hug it. It'll make you feel better. And he's like, and I'm like, dude, I wasn't in pain until you came into this room. And he goes, yes, you were. I go, yeah, my legs hurt, but my upper body didn't hurt until you just decided to hit me. I was like, you need to go away from me right now. And he's like, here, take this pillow and hug it. It'll make you feel better. And I'm like, so basically you came and punched me in the face, handed me an ice pack and said, okay, this will make you feel better. It's like, you're the one who did it to me. Go away. I was so mad. And that was right as the time my mom walked in the door. And she was like, oh, hi, are you the doctor from blah, 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 blah? And he goes, no, get out of my way.
He said that?
Yeah, like he literally was like the cockiest fucking...
You said that to your mom?
Yeah, like the dickiest dick of a dickhead ever. Like I've never...
Who's the cockiest cock and the dickiest dick?
I have literally never met so much incompetence mixed with ego. And then even in the hallways, like the nurses would be like fist fighting each other. Like they'd be like screaming and yelling. Like one time my mom said she had like 3 different people from 3 different areas, like one nurse, like one orthopedist, and one like tech, like literally like screaming at each other, like throwing stuff because they couldn't agree on like what orders they were supposed to give me. Like this hospital was trash, like the trashiest trash place ever. And it was like my whole family was there to like fight and defend and like advocate, and like I was trying to fight and defend and advocate, but like everyone had attitudes, everyone was incompetent, everyone was ego driven. And dude, they couldn't even do basic things like attach my IV correctly. Like at one point they like had to like do my IV again because they had done it bad. And then like there's these special like stickers that like go over the IV, and you're supposed to put it on like in the exact same like specific direction.
So the little cord has a place to go.
And there's little like instructions and tabs that say like this way up, this way down, wrap this around here. And they just like ripped it off and just like smacked it on there. And I was like, can you put it on right? And she goes, I ain't done yet. And I'm like, no, I'm sorry. Can you peel off the one you put on incorrectly and put on a new one? She goes, no. And just like taped it up. Like with just some like regular like cloth tape. And I'm like, well, I guess technically this works. Like, there was just so much wrong, like in every way, shape, or form. And everyone like wasn't believing me about, they would always be like, in the morning, they'd be like, give you this like nerve test or whatever. They'd be like, squeeze my fingers. I'd be like, squeeze my fingers. And they'd be like, okay, well, push up. And I'd be like, push up. Like, pull down. Okay. Then they get to my legs, be like, wiggle your toes. Like, can't do that. Why? You're not in here. You just broke your leg. You can wiggle your toes. I'm like, I have a spinal cord injury. Okay, describe that to me. I'll be like, paralysis? Like, and then I would go through the whole
I couldn't wiggle my toes before I came in here, dumbass.
Yeah, and I'd go through the whole thing where I'm like...
Didn't they go, well, try?
Yeah, well, try. And it was this whole thing where I'm like, I'm like, again, I'd be like, some places I can feel temperature, some places I can't. Some places I can feel soft touch, some places I can't. Some places I feel heavy touch, some places I can't. Some muscles I can move, some muscles I can't. And they'd be like, okay, lose the attitude. Like, they would be like mad at me for like describing what was going on. And they'd be like, lift your toes up. I'm like, can't do that. Well, try. I was like, I haven't been able to do it for a decade. They're like, press your toe down. I'd be like, okay. She's like, see, look, I told you could move it. And I'm like, what? Like, you guys are baffling me with how fucking dumb you are. How could I possibly trust you with my care? Like, it was just like constant. And like, Jalila knows, and I think a few other people know, like, how sensitive my feet are to the point where, like, even in fully, like, before this accident life, if you were just even, like, touch it too hard or squeeze it too hard, like, I would scream because it hurts so bad. Like, all my nerves are, like, always on fire there. And then, like, they would just, like, start poking at it and smacking at it and squeezing it and, like, all this stuff. And I'm like, please stop touching me. Like, you have to ask. Like, this is called consent. Like, you have to be like, is it okay if I touch you? Is it okay if I move you? May I examine you? I'm like, these are basic things. And then,
why didn't you try to move hospitals? That's probably a lot of people's question.
I don't think you can. Like, I think unless you're like a super ultra like wealthy person who can like afford like a helicopter rental to like pick you up and move you to a nicer private hospital. But I couldn't do that. And it was like this just like, my sister Rachel, she works in dentistry, and dentistry is still a form of healthcare, and healthcare requires HIPAA laws, which is like privacy and like all this stuff. And she goes, I've never seen more HIPAA violations in my entire life. They're shouting full names across the floor. They're open charts just left out everywhere with full medical information. She's like, they're discussing medications out loud. Like, she's like, I've never seen such grotesque violations of HIPAA in my entire life. She goes, this is insane. She goes, this is crazy. She's like, you would get fined just out the ass if anyone ever caught you doing this. And I'm like, I was like, had no confidence in anybody. So I was like really lucky that I had a family with me that had been through stuff like this before. Like, I couldn't even eat the food. Like, literally, I had to be like, don't bring me trays of food, because the first tray they brought me had butter and bread on it. And I'm like, hey, remember when I said I was allergic to dairy and gluten and it would have like bad consequences? Like, I was like so mad. I'm like, you guys can't even figure out a fucking diet. Like, basic things. Like, how can I trust you with anything? Like, I was so anxious about that, because I'm like, what if there's other stuff that's wrong with me? What if they like missed something on the MRI?
Yeah.
You know, what if they're poisoning me with medicine? And like, come to find out, they kind of were. Like, I had a liver laceration, and that means I was bleeding internally, and they were giving me blood thinners at the same time, which means I would bleed
multiple
more
times a day, right? Because
Yeah.
they're only like, you should have been getting like one to avoid blood clots or something, but they were giving you like more than you needed.
Well, I should have been gotten none, but the risk of blood clots outweighs the risk of internal bleeding, I guess. I don't fully understand it, but that was their logic. And then, like, no team would communicate with another team. So, like, the ICU wouldn't communicate with the main floor wouldn't communicate with like occupational therapy wouldn't communicate with the orthopedist who actually did my surgery. Like, no one knew anything. Like, anyone who came into the room, I'd be like, hi, what do you know about me? And they'd be like, I know you had surgery. And I'm like, yeah, but what else do you know about me? I'm like, what's different about me? What's unique about me? Did you read my chart? They're like, oh yeah, we looked over it. And I'm like, okay, so what's different? What's different about me? Like, I started like testing them to be like, if you don't know that I have a spinal cord injury, like, there was even one point they were like, all right, time for you to poop. Let's scoot you, put you on the toilet. And I'm like, don't poop that way. I'm like, you honestly don't know how spinal cord injury poop? Like, you seriously don't know that? Like, that's like I'm intermittent cathing right now. You've brought me intermittent caths, because it got to the point where the nurses were doing it so unsanitarily that I was like, fuck it, I'm doing this on my own. Like, they wouldn't like wash their hands, and when they would like open up the box that had like all the closed system stuff in it, they would just like put on these gloves that like, and then they thought all of a sudden magically they were sanitary, but then they would like touch the bed and like touch the blankets and like touch their face. Like,
dude, that was the worst. Dude, when I used to work at Subway, This one lady, I only worked there for like a week. This lady would put on gloves and then like do the cash register and handle money with the gloves. And then she would like start doing the sandwiches again. I'm like, just because you're wearing gloves doesn't mean you can touch anything.
Yeah,
like, oh, well, I'm wearing gloves. I can touch food now. It's like, but the gloves were just touching the fucking money.
Yeah, I get annoyed when I go to Chipotle and I'm like, hey, I have some allergies. Can you switch out gloves? And they just take off the gloves and put on new ones. And I'm like, you know that hand touched the dirty glove that's putting on the clean glove. It's like,
True.
You got to wash your hands. That's called procedure. It's like, I've been coming here long enough to know. And they'll even sometimes just pump some hand sanitizer on there. I'm like, hey, can you wash your hands? And they're like, oh, yeah, sure. And they'll like pump some hand sanitizer. I'm like, no. Can you wash your hands? And I'll just like stand there until they do it. It's like, jeez Louise, dude. Like there's so much, like I'm just constantly baffled. And it's like, that was my experience when I like with my spinal cord injury too. Like the trauma hospital that I went to, thank goodness I went there. Trauma hospitals are the bomb. Because their job is to like put you back together again, make sure you're not dead and you're alive enough that they can pass you on to get to the next person that came in. But the second you get passed on, oh boy, you're fucked. You are fucked. Like the people that work at trauma hospitals are usually like not career people. They're people that they have little to no training or they never do any retraining. There's a lot of like toxic relationships and like power imbalances inside of the units and the facilities. Everyone's ego driven. Like no one wants to do like their job, like reading charts and like paying attention and like being clean. Like they're just there to get a paycheck and leave. Like they don't give a fuck. Like this probably isn't their career. Like they just don't care. You know, it's like, it's bad, man. It's bad. And it's like usually trauma hospitals are state funded hospitals. So it's kind of, in a weird, creepy way, kind of a look into what like socialized healthcare could potentially look like. Now, who knows? Because, you know,
Do you think it's just bad leadership?
I don't know, man. I don't know.
Because it doesn't get that way overnight, you know?
It's got to be a trickle down. It's got to be like, it's everything from, I think just no one at the top pays attention to what's going on down at the bottom. I don't think that like anyone who's in any managerial or like leader or like C-level position cares about what the next group of people are doing, and that next group of people doesn't care what the next group of people are doing. They just care about collecting a check and quote unquote doing their job, you know. And it's like, you're not doing your job. Like maybe on paper you are, but you're not actually. It's like I left the hospital with an infection. Like, you're not supposed to leave a hospital with an infection. Like, that is a tragedy. But luckily, I knew how to manage it on my own. I knew how to get rid of it. I knew what supplements to take. I knew how to drink a bunch of water. Like, I knew I had one. Like, when they were like, bye, see you later.
Yeah, what was up with... So, that was one other thing that was kind of interesting, that you originally told him you wanted to get discharged. You wanted to be off Oxy before you got discharged, right? That was like the original idea.
Yeah, because
and also no one really knew how long you were going to be in the hospital, right?
Yeah, they said anywhere from like 5 days to 2 weeks.
Yeah.
And
because Jalila, you said like you're like, yeah, I don't really see it happening within like less than a week, really.
Yeah.
But then it ended up being less than a week.
Yeah, and then one of the things I told them, I was like, I want to be off opiates before I leave, because I just didn't want to have to go home. Because like normally my safety blanket is, if I have to leave a hospital after an operation or anything like that involves opiates, long term, I go stay with like my sister or my mom. But currently my sister's living with my mom and their whole family's together. Like there's no way we can add an extra body over there. Literally not possible. And it's like, we have been having people come stay over here. We threw up a cot here in the studio and people have been sleeping in here. But luckily enough, I'm at a point in my recovery where I don't have to have them like watch over me. Like I'm not taking extra doses. Like I'm writing down on paper, you know, like how far away, like how many hours I've made it. And I keep trying to like make it further. And, you know, like my like addict personality towards it is like, cause I don't like opiates, man. They make me constipated. They make me fucking dumb. You know, I get a dry mouth. Like there's just so much stuff about opiates I'm not a huge fan of, but, that was one of the things I was like, yeah, I want to be like on it, like Tylenol 800 or something by the time I leave. And like that was thrown out the window.
Pretty much.
Like there was so many
Because
times.
what did they do? They just come in and they're like, all right, you're going home today.
Well, we heard over the loudspeaker intercom, they announced, they're like, we are at capacity. All nurses need to itemize and focus on discharges. Like they literally they announced it like, shh, ladies and gentlemen, we are at capacity. Nurses, pay attention. If anyone can leave, get them the fuck out of here now. Goodbye. Doesn't matter if they're ready or not. Make them leave. Like it was like the weirdest thing ever. And then like very shortly, like someone pops in. It's like, hey, you ready to go home? And I'm like, no.
Nope. I'm in a lot of pain. Still on opiates.
I told him, I was like, I will not go home until I have wound care instructions. I was like, I will not go home unless I'm cleared by a physical therapist that actually knows what the hell they're talking about. Because all the physical therapists would roll up in there with crutches and be like, all right, let's get you up and walking. And I'm like, can't do that. You know, they're like, oh. Like one of the physical therapists or an occupational therapist, I had to explain to her what a lightweight rigid wheelchair was. She didn't know.
So that was a power chair.
She had no idea what a lightweight rigid chair was. And another lady, the occupational therapist, she's like, okay, well, we just want to make sure that you can get home. I was like, I shower on my own, I cook on my own, I clean on my own, I live on my own, I got a pet on my own. I was like, I'm real independent, I'm good, thanks. Like they wanted to send me home, like their way of like discharging me out of the hospital was going to send me home with an at-home carer.
How many hours would they be there a day?
Probably 24/7, I don't know.
Are you serious?
Yeah, they wanted to send me home with like an outsourced. And that's
a thing?
Yeah, with like an outsourced 24/7 care person. And then they also wanted me to have to do like at-home physical therapy. Another thing, this is a huge pro tip, if you are a spinal cord injury patient and if anyone does anything for you ever at home, doesn't matter if they're helping you clean your wounds, doesn't matter if they're changing your bed, if they're doing physical therapy, if they are your personal care attendant, no matter what it is, try to not do that. Because if that happens, all of your medical supplies have to be supplied by that company. Which means that if like certified nursing assistant Jessica, who's had this job for 2 weeks, who works for DBC Home Care, they're going to have to be in charge of getting all your medical supplies for you that you normally get in the mail.
And then they're like no bid, like they can charge you whatever they want basically, right?
Well, it's not just that. It's just like they don't know how to do that.
Yeah.
They're not trained on that. They literally have no idea. So like, yeah, I was talking to my friend Clint, who also had a similar surgery, a nail surgery, and he's like, yeah, dude, I told him no way. Like, I'm not going to let someone come into my house and mess up my entire ecosystem of, like, my catheters and how
sounds awful.
How I get them and where I get them. It's basically a Medicare thing. Like, Medicare, the second that they think or look on paper or there's evidence that you're incompetent, meaning, like, you can't take care of yourself, all of a sudden it, like, sends off all these, like, major red flags within the system. And then, like, everything has to be done for you. Like, you're not allowed to do anything autonomously anymore. It's like, you're fucked. Like, it'll be like, oh, if someone's at your house helping you do this, then that means you probably need to have someone live in there with you. So we're going to send someone to come live with you. And, oh, I guess that means you don't know how to order your own catheters anymore. And I guess you don't know how to manage your money anymore. So we're going to pay that company your Social Security check. And then that company is going to help you manage your money by giving you little allowances. And like, it's like this, it's like this whole mess because it's set up for mainly older people, you know? So that makes sense if you're 70, 75, 80 and you have these incompetence problems. But like, hi, I'm 30. I'm a permanently disabled wheelchair user that has Medicare because I've been disabled for more than 2 years straight. Okay? I'm not your average person. Leave me alone. Like, they were always so baffled. Like, one of the occupational therapists was like, so you want to get up and move in today? I go, nope. Like, what are you going to teach me? What are you going to show me? What are you going to help me with? Literally nothing. There's nothing you can help me with. Like, like, you are literally the most useless person in this environment right now. Like, one person even asked me, I dead asked, I was like, yo, I need to poop. I was like, I need to transfer the toilet. They go, how do you transfer? And I'm like, what? Like, you transfer?
Yeah.
Like, well, how do you transfer with no legs? I'm like everyone transfers. I'm like all spinal cord injury transfers. Like, You just transfer. I'm like, you scoot your butt using your hands. I was blown away. I'm like, what do you mean? How do you transfer? Like, I was very confused because I'm like, you should know this. Like, don't you teach this? Like, don't you teach people how to get out of the hospital bed and into their wheelchair? Like, isn't that your job? Like, I'm so confused.
Yeah. It's unfortunate.
Yeah, man, it was just like the craziest, gnarliest situation. But like, I'm lucky, man, because like I had people that were cooking me food all the time. I had people that were walking down the halls, like knocking on the nurses' doors. Like, there was like this phone system where you like dial like the nurse and be like, hey, you know, like, I'm in pain. Can you bring my medicine? They'll be like, oh yeah, sure. And then they'd show up like an hour and a half later. It's like, hey, I needed that an hour and a half ago. You know, so I had like my sisters and like my mom, and I think Jaleel even did this too, where they would just go harass the people and be like, hey, so you're going to come bring him his stuff? Hey, you're going to come bring him his stuff? Hey, can you come bring him his stuff? Hey, he needs his stuff. Can you bring him his stuff? Hey, he asked you an hour ago to bring him his stuff. Are you going to bring him his stuff? Like, they were just constantly like berating people.
Yeah.
And it's like,
I mean, I saw like even just a little bit like when you needed like ice. Like, they came and brought it in like a bag but didn't seal the bag and they just left it there. So it just like all like melted all over the countertop. And like
one time
they brought you water in a bag that wasn't sealed.
Yeah, and just like set it somewhere, and I'm like, what the
It
fuck?
spilled over everything. And then like the other weird thing was when they discharged you, they like didn't time it with the meds. So like once they had like officially discharged you, but you were still sitting in the bed or whatever, like they couldn't, like they're like, oh well, we can't give you any pain meds. It's like, well, what am I just supposed to fucking do now?
Well, that was one of the things I told her. I was like, hey, one of the nurses, I was like, hey, I took some meds at like 11. I was like, I know I can get them again at 3, but I don't want them at 3 because I know I'm leaving at 5. I was like, so I'm going to wait until I can take them. I was like, you let me know so I can take them right before I have to transfer into a wheelchair and transfer into a car and then back into a wheelchair and then come into my place and like get into a bed. I'm doing a lot of movements right now. I was like, I need to know. And then she came in the room. She's like, okay, you've been discharged. Time to go. I was like, okay, cool. Let me go ahead and get those meds. She's like, oh, no, you've been discharged. You're not on my computer anymore. And I was like, what the fuck? I was so pissed. I was like, no, you need to find a way to make that happen right now. I go, I'm currently in pain intentionally so that when it's time for me to leave, I'm not in any pain anymore. Oh, no, you're just not on my books anymore. I just can't do it for you. I'm like, no, yeah, you will. I was like, put me back in the system. I'm not leaving then. I was like, you gotta figure out how to put me back in the system. I was like, not doing it. Like, I was so stubborn on that. Like, I'm like, no. And eventually they were able to.
They gave you like some little bitch medicine.
Some little bitch boy shit that like, she was like, well, I could get in trouble for this. And I was like, don't care. Don't care. I'm like, you didn't do exactly what I asked you to do. I was like, I'm tortured right now. Like, I literally when you're laying for so long. So my leg has been like swollen up like a balloon, like a huge balloon. Like, you press it and your finger sinks in. Like, Julie, you've seen this. Like, it sinks in like multiple millimeters. And that's if I'm like laying on my back. So if I sit upright, all that blood flows to my legs and it makes it inflame even more. So all my incisions start to stretch out. It gets really hot and like feverish, and like all the nails and the bones and like all the crazy stuff, like it starts to hurt. Like, I literally like lose my breath. Like, I can't talk. Like, it hurts so bad. Like, I can't think. Like, it's so fucky. And like, man, I'm so glad I'm out of there. I'm so glad I'm home.
Yeah.
You know, I'm so
even though you didn't get off opiates before you were able to leave, like, it was for the better.
Dude, it's for the better, because the last 2 or 3 days.
Because really all they're doing, at the hospital, yes, they can like monitor other things.
All they were doing were administering drugs and checking my blood pressure for the last 2 or 3 days. And they were administering my drugs incorrectly, and the machine was broken that was checking my blood pressure. It
kept saying you were like 225 beats per minute or something, right?
Yeah, at one point it said my pulse was over 250, and the nurse logged it. And then some lady from downstairs sprinted upstairs and she goes, who's having a heart attack right now? And I'm just like, no one. I'm chilling. She goes, yeah, and most people die at 220. I'd never seen a 250 in a long time. And I'm like, and come to find out, you want to get a kick out of this shit? I figured out what they were doing. So they were taking my blood pressure on the same arm that they were checking my pulse on.
So like
the spike of them checking, so the blood pressure cuff was squeezing my arm, creating a pulse of 220 within that arm for approximately 10 seconds. And that's when it was reading it. So I was like, this is nursing school 101. Do not take blood pressure on the same side that you check the pulse because gonna be different.
you're cutting off the pulse, you dumbass.
Yes, like I literally like
Let's check the pulse on the place where we just cut off the pulse. That'd be nice.
yeah, and then they literally like took the machine and like tested it on their own finger and they're like, it's working fine here, and like put it on my sister and it's like, it's working fine over here, and I'm like,
She's not having a heart attack, must be you.
and I'm like sitting here like, you guys are fucking stupid. Like I remember one time this lady like had this like really ice cold drink
Didn't it happen multiple times?
multiple times.
Was it the same person that did it?
No, it was different texts like each time. Like
So they're just that stupid.
When I say the lack of training and incompetence was baffling, this is what I mean. There was even like at one point they checked my temperature after they gave me a cold drink and were like, "Ooh, your temperature's a little low." I'm like, maybe because you just gave me my meds with ice water. And my mouth's a little bit colder. Maybe that's the reason
Give
why.
me a rectal one.
It's like, dude, like how stupid
Yeah.
are you guys?
Very dumb.
Like, but yeah, like when I got sent home, I was like, thank fuck, man. I was like, because at least at home, I get to decide when I take my meds at the right time. I get to decide when I pee at the right time. I get to have a kitchen available for me to help me cook. I get to have people stay over and take care of me and kind of take a quote unquote nurse's role, but it's not even a nurse's role. You're just like hanging out with me, and when I'm like, hey, can you bring me a water bottle, and like, hey, can you move my feet, and like, hey, can you cook me some food, it's like, it's not drastically difficult. But man, I'm so glad I'm out of that stupid fucking tragedy of a hospital.
Hope you enjoyed that clip. If you want to watch the full episode that clip was from, you can click right here. If you want to subscribe to the channel, you can click right here. And if you want to watch more clips, we got 2 more right here.